So, mm, okay, go. Good evening. My name is Lydia Molonda. Today I'm talking about assertive communication. Mm. Assertive communication is a style in which the communicator clearly, confidently, and respectfully expresses his thoughts, feelings, and needs. It enables people to be both op- op- attentively and attentive to others. This type of communication falls somewhere in the middle of passive communication where someone might not be able to express himself, and aggressive communication where someone might ignore someone might ignore another person's feeling. Assertive communication Assertive communicators are expressive, um, look people in the eyes, and are respectful in healthcare. For instance, a nurse who discusses treatment options with a patient without being aggressive and speaks with empathy when a patient is questioned illustrated assertive communication. Um, the strength of assertive communication is is to build trust, reduce confusion, encourage teamwork, support patient safety. There are numerous advantages of assertive communication in health and social care. This helps to establish trust as patients feel respected and understood. Communication is clear and direct, which enhance communication and minimizes confusion relating to treatment. It also fosters collaboration and teamwork as team members are able to openly and honestly exchange ideas with one another. Plus, it decreases conflict by giving the opportunity to resolve issues in calm ways. Most important, most importantly, it helps to ensure the safety of the patient by making instruction easy to give and follow. Patients are more likely to take medicine correctly and safely. For instance, if the doctor's instructions are clearly explained. Mm, the explained, yeah. So the limitation of assertive communication um, is powerful, but context matters. Challenges arise where individual needs, culture, value, or emotional states are not account, accounted for. There are some drawbacks to assertive communication, but it works well for some patients. It might seem too direct, particularly if they are sensitive or emotional. emotional difference that exists in culture can also be a fact in understanding communication. In certain culture, your direct approach may be regarded as rude. Confidence and practice are also necessary in assertiveness, and not everyone in the healthcare field will be able to do it. Communication might not be possible if there is a crisis or stress. For instance, a distressed client might not react to a direct approach and might need a gentle approach for approach with support. Um, the role of assertive communication in person-centered care. Assertive communication places the individual patient at the heart of every interaction. Every interaction. Understand differences, explore feeling, concern, and value, encourage participation, patient speaks openly and contributes to care decision, build respectful relationship, patient feel valued, respected, and satisfied with care. Person-centered care is a way of working that will benefit patient needs, and assertive communication is a key strategy for this. It aids healthcare professionals in better comprehending patients' preferences, feelings, and concerns. This communication approach helps patients to express their ideas and participate in their own treatment decision. It also contributed to the development of a good relationship and respect between carers and patients. Person-centered practice may be demonstrated by asking a patient about how they feel they are being cared for and taking steps to change their care based on their answer. In return, patients feel appreciated and respected and content with their care. Content with their care. Improving teamwork using assertive communication is clear information sharing, reduce misunderstanding between doctors, nurses, and support staff, improve decision making, open discussion leads to better clinical outcome, define role and responsibilities, everyone understand their contribution. So good communication is crucial to working in a team in health and social care. To communicate openly and accurately with colleagues and clients, assertive communication is used to avoid misunderstanding. It also improves the teamwork of all team members, including doctors, nurses, and other healthcare workers. This leads to improved decision making and healthcare results for patients. Communication contributed to creating an understanding of the role and the responsibilities of everyone involved. For example, when doctors and nurses discuss treatment openly, they can substantially reduce the chance of errors, will improve the quality of care. Hence, associative communication is an important aspect of working toward common goal in health care team. So communication is a vital skill in health and social care, enabling clear and respectful interaction with patients and colleagues. It is key strengths, trust building, advocacy, and teamwork make it particularly effective in MDT environment. Uh, the environment and patient-central care. Limitations such as cultural differences, power, hierarchy, and emotional barrier must be recognized and addressed. Thank you. Thank you so much.